Welcome to Medical Marijuana and Wellness. Today's topic is fibromyalgia and medical marijuana. A very important topic for people that are suffering from fibromyalgia and looking for alternatives for the pain and many of the symptoms that come with fibromyalgia. Joining me today is Amy Green, a registered nurse with MMTC of Florida. Amy, welcome, and tell us a little bit about yourself.
Hi, Marc. Thank you for having me. Of course, I'm a registered nurse and I work for Medical Marijuana Treatment Clinics of Florida. I primarily do patient education and helping patients develop a treatment plan based on the symptoms that they're experiencing and the specific things that they're trying to address, along with doing a lot of education on dosing and just product information so that patients actually feel comfortable using products that they buy.
Sure. And I should point out that this presentation is for information purposes. Naturally, anytime you're looking for medical advice, get a hold of your doctor, your medical marijuana doctor, or your medical marijuana practitioner to help you with that. But that being said, let's talk about fibromyalgia. First of all, let's understand what it is, because by understanding what it is, we can understand where cannabis can help us. Amy, what is fibromyalgia?
Sure. So the biggest thing with fibromyalgia, the hallmark is going to be widespread pain throughout the body. There's also going to be some extreme sensitivities, fatigue, poor sleep quality. There could be headaches or symptoms of IBS. And some patients may also experience anxiety and depression. Some women may feel extremely painful periods with their fibromyalgia. They may also have sensitivity to hot or cold. And they may also have problems like tingling, numbness, or a burning sensation in their hands or feet.
Yeah, and I think some people have fibromyalgia to the point where you just touch their skin and they get a tingling sensation that's there. It's interesting that when you take a look at when it worsens when you have a higher stress level, changes in the weather, and also physical activity. But Amy, from the National Pain Report, when did a lot of people start finding that they had fibromyalgia?
Sure. So the first time that patients usually report having a flare, which is a increase or worsening of symptoms, is usually between the ages of 18 and 34. Now, this flare could be caused by a number of different events. So it could be just stress levels, changes in the weather, changes in activity level. There's a whole host of different things that could contribute to that flare.
Mm-hmm. It's interesting that all that is really happening. Now, what's fascinating is that Ethan Russo produced a study in 2016. This is a medical study that was put out there where he looked at symptoms and fibromyalgia itself. And what he found out is that there's evidence that endocannabinoid deficiency really can characterize this particular condition. Now, a lot of people don't know what endocannabinoids are, and so we're going to talk about that in just a minute. But it's interesting that this particular study identified a particular condition of the body that's really causing a lot of the, not only symptoms, but really fibromyalgia. Let's talk about what different symptoms people run into. Amy, there's a lot of different things from pain messaging all the way down through stressful events.
Certainly. So a big one is going to be changes in the way that our central nervous system process those pain messages throughout the body. Patients with fibromyalgia are going to also have some chemical imbalances in their body. This may be hormones such as serotonin, norepinephrine, dopamine. They're also going to have changes in their cortisol levels. Cortisol is directly linked to stress. Some people may know it as the stress hormone. Patients with fibromyalgia may also have some sleep disturbances. This could be a change in their sleep pattern. They may have insomnia. They may have problems staying asleep. And then also they're finding that there is some genetic component to fibromyalgia. It does seem to play a small part as far as we understand so far. And then finally, fibromyalgia can be triggered by very stressful events. This could be an injury or infection, giving birth or having an operation. Also life events, not just physical events, ending an important relationship or being in an abusive relationship or even the death of a loved one. All of these different events, whether they are physical, emotional, mental, can absolutely trigger a flare for somebody with fibromyalgia.
Sure. Now, what's fascinating is that the same report pointed out that 44% of the people that were surveyed found out it took 5 years for them to be diagnosed with fibromyalgia. And that's living with a lot of pain and a lot of these symptoms for a lot of years. And also, 45% of them reported that their families really didn't take the condition seriously, which obviously, if you have fibromyalgia, it is a serious condition. So it's interesting that 4 out of 10 of the fibromyalgia sufferers felt that their doctors didn't have enough knowledge of the situation to be able to treat their system. I'm just pointing out what the system or what this particular report was reporting. Let's dig down into medical cannabis studies that have been out there. This one from Germany is interesting. Up here, one from 2006. It really was the first study that came out that showed THC was effective for fibromyalgia.
Yeah, and the interesting thing about that study was they were looking at relatively low doses of THC, somewhere between 2.5 and 15 milligrams, which are pretty small doses.
Yeah, and it really worked. And then, of course, 2011 was another study that was very interesting, where it talked about not only how it addressed pain, but also stiffness, improvement in insomnia, and your overall well-being.
Absolutely. And sometimes it's just that being able to relax that is super helpful for patients. Sometimes they might just have so much going on that it's contributing to a flare, or it's causing pain or other side effects that they're just not comfortable with.
Yeah. And the 2014 study, which was done by the National Pain Foundation with 1,300 patients, 390 of them were using medical cannabis, came up with a pretty effective result.
Yeah, so they found that compared to other products that patients were using, this is usually opioids, is usually what this is compared to. I mean, over a third of the respondents in the survey found that cannabis products were effective or more effective than the other products they were using.
Sure. And that's really important to be able to point out is, again, these are studies that are being done to really take a look at the efficacy of medical marijuana and fibromyalgia. 2018, a more recent study, again, another low dose study.
Yeah, and so with this one, patients were using relatively low doses, less than a gram a day, and they were finding that it was bringing them back to more of what the patient would consider a baseline for them.
Mm-hmm.
So helping with pain, stiffness, spasms, and just allowing patients to live their life more normally for them.
Yeah, we're going to talk about dosing at the end of this particular webinar, but it's really important to point out that more is not better. These are low doses that are working. Sometimes people think, well, if I take more, it's going to really help improve it, but really low doses find your therapeutic dosing range really is what you're looking for. We'll talk about that later, but this study really highlights that. Also, the 2020 study, which estimates that 5 to 7% of the global population have fibromyalgia, also had a very positive response for cannabis and fibromyalgia.
Yeah, they found that a lot of patients that have fibromyalgia may respond poorly to more traditional pain treatments, and medical cannabis seemed to fill that void for them. It seemed to be more helpful for them.
Yeah. So, I mean, there's more studies than just this. These are just some of the key and highlights that are out there, but we've really found that medical cannabis really can help with fibromyalgia. Now, why does it work? We used a lot of terms earlier, like endocannabinoid system. Let's explain what that's all about. We all know we have a nervous system. It's something that we are aware of. I call it the cell phone system of the body. When one part of your body senses or feels something, it communicates that through the spinal cord up to the brain and says, Houston, we have a problem, or Houston, here's you have a condition. And we've dealt with that for a long time. The medical community has known about this. But the question is, when the nervous system reports, Houston, we have a problem, what did it do, or what does it do with that particular problem? And this is where, when we started looking at studying medical cannabis, we found out that the body has a endocannabinoid system. Every mammal has an endocannabinoid system that helps you manage your pain, your anxiety, your memory, your appetite, inflammation, and also your immune responses. This is the thing that drives your body. Amy, this was an important breakthrough.
It really was. Before this time, like you were saying, we understood the circulatory system, we understood the nervous system, but we didn't understand um, what these chemical signals in the body were doing and how they connected to each other. And so that chemical signaling, that is the endocannabinoid system, and it really does affect all of these different parts of the body, both mentally and physically.
Yeah, and these CB1 and CB2 receptors you see here, which are the kind of the lighter pink and the darker burgundy kind of colors, are really throughout your whole body. And this is an important part of your body managing itself. In fact, specifically, what your body wants to do is put itself in what they call homeostasis, your body in balance. This is when you feel good. How does your body manage that? Well, you have endocannabinoids. Your body will produce endocannabinoids naturally when there's a problem. Houston, we have a problem. It'll produce the endocannabinoids. Your brain will trigger those, and they'll be sent through your bloodstream to that part of the body to be able to address your particular situation. Now, why would I address or bring phytocannabinoids or cannabis-based cannabinoids into my body? A lot of it has to do with, for example, I'm a senior citizen. My body doesn't produce endocannabinoids like it did before, or it might be a situation where I have an operation, a knee replacement or something like that. In my case, I have herniated discs in my neck. And so I need an additional amount of cannabinoids in my body for my body to do its job. And really, these phytocannabinoids are kind of magic for your body.
They are. So the nice thing about phytocannabinoids is that it is supplementing your endocannabinoid system. So as Dr. Russo said, there seems to be or is possibly a connection between the level of endocannabinoids in our system and fibromyalgia. So especially people with fibromyalgia, supplementing their endocannabinoid system with phytocannabinoids can be very beneficial in trying to reach homeostasis, just bring their body back to where it wants to be.
Right. And it's important to point out your body and your nervous system communicate together. They work as partners to be able to put your body in homeostasis, but they basically keep your body in homeostasis. Cannabis is broken down into some components. Cannabinoids, terpenes, and flavonoids, they each have their own purpose, right?
They do. So cannabinoids are going to be the major part of the plant, and there's a couple that everybody's really heard of. So you have THC, you have CBD. Those are going to be the two big ones. And then you have terpenes. Terpenes are going to be what give cannabis its smell and its taste. They're also going to drive a lot of the beneficial parts of the cannabis plant. And then finally, you have flavonoids. They are also going to contribute color, smell, and taste to the cannabis plant, but also contribute a lot of therapeutic benefits. Along with terpenes and cannabinoids, they're all addressing inflammation. They're all addressing pain. They are all doing a job, and when you combine them together, they work awesome.
Yeah, this trinity of components, cannabinoids, terpenes, and flavonoids, working together create an entourage effect. And what that means is that really 1 and 1 is 3. Working together, they give you better medical benefits than by themselves.
Certainly. And this is, there's some great examples here. Like CBD will lessen the psychoactive potential of THC. So they're balancing each other. And like terpenes are going to enhance the medical benefits of the cannabinoids. And then when you put CBD and THC together, they're enhancing the medical benefits, whether that is analgesic pain relief or anti-inflammatory properties. They really all work better when they're all together.
Yeah, and that's really the magic of cannabis, is them working together. Now, you mentioned CBD and THC or Delta 9 before. Really, CBD is found in both cannabis and also hemp.
It is. So the difference between cannabis and hemp, we'll get into that in just a moment. But yeah, CBD is found in both of those. The biggest thing is CBD is going to mainly want to connect to CB2 receptors, which are in the peripheral organs and the immune system in the body. This is versus Delta 9 THC, which is found in the cannabis plant. We'll address the 0.3% question in just a moment. But the big thing with Delta 9 THC is it does have that psychoactive potential to it, and it's mainly going to be attaching itself to CB1 receptors, which are mostly in the brain and central nervous system, which is what potentiates that psychoactive effect.
Right. And this is why THC, although sometimes it gets vilified, is really very, very effective to be able to help with pain management and to be able to help with conditions like PTS and brain injuries that are there. But let's talk a little bit about the different receptors that these two cannabinoids really address, the CB1 and CB2 receptors. As we mentioned, in the immune system and peripheral organs, CB1, CB2 in inflammation and immune response, and also throughout the whole nervous system. Although CBD and THC do work with both receptors, THC mainly works with the CB1 receptors, CBD mainly works with the CB2 receptors. It's really interesting how they really, let's just say, home in on being able to help those particular conditions. But CBD has a aspect to it that's even more important than the endocannabinoid system. It works with other receptors in the body.
Yeah, and so that's what's really neat about it. It's also going to connect to the 5-HT receptor, A2A, VR1, and GRP55, amongst others. That is just a small list of them. But I mean, these systems are going to be your serotonin receptors, inflammation throughout the body, pain receptors, blood pressure. So all of these things are really interconnected in the body, and CBD is affecting all of those things.
Right. It's interesting. CBD really is, in essence, a super vitamin when you really look at it. I put together here this little slide that shows the different cannabinoids and how they affect the different receptors that are there. I don't really want to dive down into this because we will have a cannabinoids webinar coming up. We can really dive into a lot of this. But I just want to point out CBD does have a lot of very positive effects on your body. Again, in inflammation, helping you sleep, and being able to address a lot of the different conditions that are there. I just wanted to share there is medical evidence of this. That's the objective. We talked about this famous 0.3% THC level. Really, that is the legal, and let me underline the word legal definition of hemp versus marijuana. If it's 0.3% THC or less, it's considered legally as a hemp product. And if it's 0.3% THC or more, it's considered to be a marijuana product legally. And that has a lot to do with the legal classifications. That legal classifications leads to whether you can buy it or not. Because hemp you can buy legally in all states because of the low THC level. Marijuana, you actually have to have a card because it's still a Schedule I drug. Amy, what's some of the common uses in physical appearance of marijuana versus hemp?
Yeah, certainly. So the biggest thing that most people will notice is hemp is going to be tall, lean, and have shiny leaves, where marijuana is going to be more squat, bushy, and have fuzzy buds or flowers on it.
Yeah, that's why they call it weed, right?
Indeed, yeah.
And I think some of the common uses are hemp has been made for a lot of industrial uses, both textiles, hygiene products, and paper. More importantly, it's been used for rope. I mean, hemp rope has been used. It's probably one of the most effective ropes in the world. So important that even though hemp was made illegal in the United States starting in 1938, we still produced hemp and hemp rope all the way through 1948 because of its importance to the war effort. So I think it's very, very important to differentiate the two. Both are great products. They all have their particular uses. And again, for fibromyalgia, we're really talking about medical marijuana products because of the fact that we need to get that higher THC to be able to address the condition. But besides the amount of cannabinoids, we have some terpenes that really play an important role. Tell us about this.
Yeah, so terpenes, again, it's what gives cannabis its smell and its taste, but they really have a lot of benefits. So when we look at, say, limonene, it's going to smell like lemons. It's going to have that fruity, citrusy smell, but it's also going to help with mood, anxiety, stress, anti-inflammatory, just like pinene as well is going to smell like pine needles. It's pretty simple. Pinene is great for pain relief, analgesic effects, again, stress and anxiety and inflammation. When we look at something like linalool, this is what you are smelling when you smell lavender. That is straight up linalool. That's going to help with mood, anxiety. It can be sedative. It can help with sedation, so it can be good for going to sleep or if you have any insomnia problems. Linalool can be very helpful for that. There are so many terpenes, and they all have a lot of benefits and things that they do. I just don't think we can get into all of them today.
Yeah, there are actually 200 different terpenes that we know about. There's 100 of them being studied. This particular chart shows kind of the Hall of Fame, or the main ones that people use that are found in a lot of products. Now, I should point out that things like myrcene, caryophyllene, eucalyptol, all are very important products when it takes a look, are important components when you're looking at something to address fibromyalgia. When you're looking at fibromyalgia, make sure your products have linalool, limonene, caryophyllene at least in them to be able to address your particular condition. And I do want to point out, each of these terpenes are temperature sensitive. What that means is over that temperature, they get burned off. And we'll talk about that when we talk about routes of administration. This is going to be very important. But dialing in the right terpene profile is something that's really important when you look at your route of administration. Now let's talk about how you take cannabis, because this is important. I recommend taking cannabis in a way that you're comfortable with. I know a lot of people aren't comfortable with smoking, and some people are. But I think the best way to start is with sublinguals.
Yeah, and there's really a couple reasons for that. They are incredibly easy to dose. Most of them just are going to come with an eyedropper, and you'll just either count drops or look at the measurement on the eyedropper. Very easy to dose. But also, there are so many varieties of tinctures. So you may have ones that are high THC, low CBD, high CBD, low THC, ones that are just THC, or ones that are just CBD, and every single variety in between. Tinctures are definitely the widest availability of ratio products.
Yeah, and that ratio product's important. What you mean by ratio is the ratio of CBD to THC, because when you hear of something like 1-to-1, that's 1 CBD to 1 THC. If you hear of a 9-to-1, that would be 9 CBD to 1 THC. The first number is always CBD. What's important was when you find out what your tolerance is to THC, your therapeutic dosing level, and we'll talk about that in just a moment, how to find that. You can then increase the amount of CBD, that ratio of CBD, to really help you get more benefits from the CBD products without necessarily having you get high. I think that's really important. That's where ratio products come into play. And really, sprays fall in that category of an onset time of about 15 to 20 minutes and work between 4 to 6 hours. But another effective route of administration, especially for fibromyalgia, is topicals.
Yeah, so there are a couple different types of topicals. So you'll have your classical topicals. Those are going to be just localized relief to wherever you put it. So it's like you wake up, your knee hurts, put some on your knee. It's only going to help your knee. And then you'll have what's called transdermal topicals. Those are products that are going to be applied to the skin, but they'll go through the skin and actually enter the bloodstream. And besides giving localized relief to wherever you applied it, it will actually be systemic throughout the entire body. So it's not only providing localized relief to wherever you put it, but it's going throughout your entire body and addressing pain, inflammation everywhere as well.
Sure. I think topicals are very, very important. And again, onset is almost immediately, and they'll last anywhere from 1 to sometimes 72 hours when it's a transdermal patch, which is a great way of relief. Now, we hear a lot about the famous gummies, the orals, the edibles, the lozenges, gummies, brownies, cookies, as well as capsules. You know, those have an onset time of between 15 minutes to 2 hours and last between 4 to 10 hours. I mean, I like to use an edible in the evening just before I go to bed. I use it 2 hours before I go to bed, and it helps me sleep through the night. But you really got to be careful of edibles because they take potentially up to 2 hours of work, right?
Absolutely. And especially when using edibles or starting to use edibles, I really recommend using a treatment journal just so that you can track when you took the product, how much you took, when you started feeling the effects of it, and then how long those effects lasted for you. That's going to give you a lot of helpful information for how often you might have to take that product, but also how long you're going to have to wait for it to kick in.
Yeah, we have a famous saying that about the time you think it's not working and take another one is about the time it starts working.
Yes.
So be careful of edibles. You know, just don't pop them like Skittles. You know, there's a lot of famous stories about people that thought that it wasn't working and they took 2 or 3 more. Be careful. Just, you know, be cool when you use edibles. That's my advice for that particular category. Now let's talk about inhalation. Some people like to smoke products. Flower is very popular, also concentrates in inhalation. Let's start with flower, because when you use flower, and you roll a joint, it works almost immediately. In fact, it works immediately, has a 2 to 6 hour duration. But when you take a joint, you take that cannabis flower, roll it into a blunt, and then you go to light it, you have a 550-degree temperature flame that lights it. You're really burning off about half of the cannabinoids, almost all of the terpenes, almost all the flavonoids. So smoking it in a blunt form of flower really reduces the medical efficacy of that particular product about 40 to 60%. But that's the bad news. The good news is it still works, but it's only working at about 40 or 60% of its efficacy. I personally prefer, if you're going to want to smoke flower, to use a dry herb vaporizer for two reasons. Number one, there's no burnt material, because when you use a dry herb vaporizer, it's steaming it or vaporizing it versus burning it. Burning it gives you that burnt material, which can get into your lungs and not be very good for you. When you vaporize it, you're just putting steam. In other words, smoke into your lungs. The smoke into your lung is vaporized. You're not getting the carcinogens that's in there. I think dry herb vaporizers are important.
Absolutely. And I really think that there's a couple reasons why they are superior to using or to smoking, classically smoking flower. And a big one is going to be temperature control. Usually, when you're using a dry herb vaporizer, you are able to control the temperature, and you can really get into that sweet spot where you're getting all of the terpenes, all of the cannabinoids and flavonoids, and they're not burning off. So it's being more beneficial to you, and it's not just being burned off by the high temperature.
Yeah.
The other part of that is you're not having all of the byproducts of combustion. Dry herb vapes usually use either convection or conduction to heat the flower, but it doesn't actually combust it. So you're actually left with all of the plant material left over afterwards.
Yeah, and I think that's really important. It's much better for you. Again, if you want to smoke flower, I'd recommend a dry herb vaporizer. That's just my recommendation. Now, if you want to be able to really dive down into it, concentrates are important. They're actually where you take the cannabis flower and put it into a shatter, distillate, crumble, rosin type format. But more importantly, in cases like rosin and resin, which you're only using either a pressure or freezing the product, you're getting all of the terpenes in the product, so that when you use that device, that concentrate pen, because you load these concentrates into a pen, you can actually set the temperature of that particular pen to low, medium, and high, and be able to really trigger those terpenes. That's a really effective way of using medical cannabis. Now, the other is when you take a look at inhalation in vape pens which you buy come in either no setting at all, and if that's the case, the vape setting is at 390 degrees, or it has a low, medium, and high setting, which again triggers those lower, medium, or high terpenes that are there. This is important to look for. Is that correct?
It is, yeah. So I would definitely recommend having a vape pen that has adjustable temperatures. And that's because you really want to target um, different terpenes. So lower temperatures are going to give you more availability of those terpenes. Higher temperatures, those terpenes might burn off more, but it might make the THC a little bit more psychoactive at high
Right.
temperatures.
Right. The temperature, really, if you can home in on those terpenes, it'll be very effective in addressing your condition, your fibromyalgia condition that's there. Let's talk about that sweet spot. We talked about dosing. Really, what we're looking for is what they call your therapeutic dose. In other words, how tolerant are you to THC? Our bodies, just like alcohol and caffeine, are all different. Some people have high tolerances to alcohol. Some have low. I have a friend of mine that has one drink, he's done for the night. I have another friend of mine, after a bottle, he's just getting started. And really, it's the same with medical cannabis. We really have to find out what our tolerance is to THC. Once we do that, then we can use those ratio products to increase the amount of CBD and really home in on a product for us. But more importantly, by starting low and going slow, you're able to use a product like a 1-to-1 to find your therapeutic relief level, and your body will tell you. And then once you pass that, you won't feel as well, just backing down. You're able to really dial that in. Amy, this is an important process.
It really is. And the idea is that we want to help you find the lowest possible dose to receive the benefits that you're looking for without unwanted side effects. The unwanted side effect that we're usually trying to avoid is that stoned, heady feeling. You know, it's a medication, so we don't necessarily want to feel stoned or high. We just want to have relief from whatever we're trying to treat. Um, and when we're looking at therapeutic range, so you have a subtherapeutic, so we're not quite at that sweet spot yet, but you also have, it says toxic range here. I would say just not therapeutic. As you go too high, you're going to start getting into the psychoactivity, the it just you're
Well,
not having
you feel
the same.
somewhat uncomfortable, for
Yeah,
example.
you can. Yeah, you're going to start losing the medical benefits, and you're going more into um, just getting very high.
Right. And so that's where you back down. So if you're using let's say you're using a tincture drops and you're using, let's say, a half of eyedropper or maybe 3/4 of an eyedropper, and you're feeling good, and then you increase that a little bit more and you begin to not feel as good, back down. Go back to that half eyedropper. That tells you what your THC therapeutic dose is. Then you can increase the amount of CBD, use a ratioed product to increase the amount of CBD to really help you with the other conditions that you're really looking at. This is very, very important. And the key is, people always say, how much should I take? We can't answer that question. Again, like alcohol and caffeine, your body tells you. Your doctor can't tell you. Your body will tell you. As you're using it, I can tell you, as a person who really was trying to address serious pain in my neck from auto accident, where I ended up with herniated discs in my neck. When I began to feel relief, I knew it was there. And when I began to feel uncomfortable, I knew that. So I was able to adjust my dosing really and control it and keep my pain level as less than 1 for a very, very painful condition. Amy, we have covered a lot of topics. Do you have any final thoughts?
Yeah, so as always, I'm going to always suggest using a treatment journal. It's just going to give you a lot of information for what products you're using, how you're using them, how much, and are they effective for you? Keeping track of what you're taking, when you're taking it, when it started to take effect, and then how long it lasted is going to give you so much helpful information. And then, of course, I always recommend starting at a very low dose and then gradually and slowly working up to a dose that's effective for you.
Sure. That's great. Now, if you're looking to get a medical marijuana card in Florida, also in Ohio, as well as in Mississippi, look at MMTC, Medical Marijuana Treatment Clinics. They can help you with that. If you're looking at CBD products that have been tested and verified by physicians, we have a My Botanical Wellness site to take a look at that. And also, this video, as well as other videos on medical marijuana, are found in our YouTube channel, YouTube Marijuana Aware. And it's something that you might be able to take a look at, not only just because of fibromyalgia, but we talk about dosing, we talk about routes of administration, many other resources that's out there. So please feel free to access that site. Remember, subscribe and like. It'll help us quite a bit. Thank you very much for joining us. You can follow us on social media, Facebook, Twitter, also Instagram. We're on, naturally, the YouTube channel, and of course, these webinars that we do weekly. Thank you very much for joining us, and we look forward to helping you get your life back.